In many parts of the world, village life reflects both beauty and struggle. These communities are often close to nature, rich in culture, and built on traditions that go back generations. Yet they also face some of the most difficult challenges when it comes to health, hygiene, and living conditions. Limited access to clean water, proper sanitation, and healthcare makes everyday survival more complicated than it should be. This script will explore the connection between health, hygiene, and the environment in rural communities. We will discuss how poor living conditions affect families, why education and awareness are essential, and how diseases such as Jigger infestation illustrate the urgent need for change. More importantly, we will look at possible solutions and the power of resilience in creating healthier futures. The reality of village life. Villages around the world share common characteristics: simple housing, reliance on small-scale farming, and strong community ties. But for many families, life is marked by poverty and the daily effort to secure food, water, and shelter. Basic infrastructure such as clean drinking water, electricity, and accessible healthcare is often missing. Children grow up in homes without proper sanitation. They may walk long distances to fetch water from rivers or wells, which are sometimes contaminated. Without reliable income, families struggle to provide consistent meals, school supplies, or medical care. These hardships not only affect physical health, but also mental well-being, especially for children who learn to carry responsibilities too early in life. Health and hygiene challenges. One of the biggest challenges in rural settings is maintaining good hygiene. Something as simple as hand washing can become difficult when water is scarce. Without toilets or proper waste disposal, diseases spread quickly. Malaria, diarrhea, and respiratory infections are common in these communities and can have devastating effects, especially on children. Skin diseases, fungal infections, and parasitic infestations thrive in areas where sanitation is poor. One such example is the Jigger parasite, also known as the sand flea. It burrows into the skin, usually the feet, causing pain, infection, and sometimes permanent disability if untreated. While the Jigger is just one of many health problems, it highlights how something preventable can destroy lives when hygiene and healthcare are neglected. The impact on children. Children are the most vulnerable. Poor nutrition, lack of clean water, and untreated illnesses weaken their growth and learning abilities. Many children are forced to miss school, either because they are sick or because they must help their families with daily survival tasks. Education is a powerful tool for breaking the cycle of poverty and disease. Yet, without proper health and hygiene, education itself suffers. Imagine a child trying to focus in class while battling hunger, stomach pain, or untreated infections. It becomes clear that health and education are inseparable. The environment and living conditions. The environment plays a key role in shaping health outcomes. Mud floors, leaky roofs, and poorly ventilated houses create conditions where disease spreads easily. Stagnant water becomes a breeding ground for mosquitoes, while piles of waste attract flies and rodents. Environmental awareness is crucial. Communities need support in building safer homes, creating waste management systems, and ensuring that water sources are protected. Simple improvements, such as raising beds off the ground, using treated mosquito nets, or building latrines, can make a significant difference in preventing disease. resilience, and community strength. Despite the challenges, rural communities often show remarkable resilience. Families learn to share resources, neighbors help each other during crises, and children adapt with surprising strength. This resilience should be celebrated, but it must also be supported with real solutions. Community-led initiatives, such as village hygiene programs, water purification projects, and school health campaigns, are powerful tools for change. When people take collective responsibility for their environment and health, progress becomes possible. Possible solutions. Addressing these challenges requires both local action and global support. Some effective strategies include clean water access. Installing wells, boreholes, and water purification systems can dramatically reduce waterborne diseases. Sanitation facilities. Building toilets and teaching safe waste disposal practices prevents contamination. Health education. Teaching families about hygiene practices, nutrition, and disease prevention empowers them to protect themselves. Medical outreach. Mobile clinics and rural health workers can bring essential services to isolated communities. School programs. Providing meals, hygiene kits, and health lessons in schools helps children stay healthy and motivated to learn. Environmental care, encouraging tree planting, safe cooking methods, and waste recycling improves living conditions and reduces health risks. When such solutions are applied consistently, diseases like Jigger infestation, malaria, and diarrhea can be greatly reduced. Families can focus less on daily survival and more on building brighter futures. Why awareness matters. Many of the world's problems persist because they are invisible to those who live far away. Urban populations may not realize how deeply rural communities suffer from issues that are entirely preventable. By raising awareness, we create empathy and responsibility. Awareness also inspires action. When people understand the struggles of rural families, children walking barefoot, mothers lacking medical care, fathers working tirelessly to provide, they are more likely to support initiatives that bring clean water, healthcare, and education to villages. The bigger picture. Health and hygiene in rural communities are not just local issues. They are global concerns. Disease does not respect borders. When communities remain vulnerable, humanity as a whole is affected. Every child deserves the chance to grow up healthy, educated, and hopeful for the future. Every family deserves the dignity of clean water, safe shelter, and basic health care. The fight against diseases like Jiggers is not just medical. It is social, environmental, and educational. It requires compassion, innovation, and collaboration. In the end, village life teaches us important lessons about resilience, family, and survival. Yet, it also reminds us of the urgent need for better health, hygiene, and environmental care. Preventable diseases should not define the lives of children or hold back entire communities. By working together through education, awareness, and practical solutions, we can transform living conditions for millions of people. Whether it's preventing Jigger infestation, improving sanitation, or ensuring that children receive both food and schooling, every step matters. Let us take inspiration from the strength of rural families, but also commit ourselves to supporting them with the tools and opportunities they deserve. Health, hygiene, and dignity are basic human rights, and when we invest in them, we build not just stronger villages, but a stronger world.